Hi everyone, welcome back to Nursing Guru. Today we are going to study or discuss about the suture material and removal of suture. Here I am going to explain certain topics regarding sutures such as definition, goals of suture, techniques of suture, then surgical knots, then suture removal. Definition of suture. Suture is a stitch or series of stitches which is made to secure the apposition of edges when there is any surgical wound or any traumatic wound. Apposition, APPOSITION. That means bringing something close or side to side. So here we are using some suture materials which are used to suturing. Suture materials are the artificial fibers used to keep them together bounded in a proper shape or the edges in a proper alignment. Goals of this suture or suturing is to wound edge apposition. That means to match up or to bring them together in a proper alignment so it can wound in a proper stronger scar. Then the next goal of suturing is hemostasis. Hemostasis is nothing but stoppage of bleeding or preventing the wound from too much of bleeding, increase of bleeding. So increase of bleeding will leads to hypovolemic condition. The patient may undergo into severe shock. So that is why we are doing suture so that it can prevent the bleeding. Then we are doing suture because of avoid wound infection. When there is any open wound, there is more chances of the infection to entering into the fresh tissue and it may grow and it may affect the healthy cells which are present in the wound area. Then the next goal of suturing is to protect the wound from getting more deeper or making it more worsen. So these are the goals for suture or suturing. Next we will move into the characteristics of this suturing. There are many characteristics of the suturing. We will discuss only 4. First one is the physical structure of the sutures. Second one is the tensile strength. Third one is the absorbability, and the fourth one is the biological behavior. First one, physical structure of the suture. Physical structure is again divided into 2 categories. One is monofilament, second one is multifilament. Monofilament is nothing but a single fiber or single thread a suture is made up of. Multifilament is made up of multi fibers which is brought together and made a single strand of suture. So here monofilament is a single strand, that is why it is very smooth and very easy to handle. But this smoothness of this character is also a problematic while suturing. It is very difficult to knot a suture. And also when you hold it or grip it with needle holder or any kind of forceps, it may damage the suture material of this monofilament sutures. Multifilament is very easy to tie a knot because there are many fibers, many filaments coming together, and that is why it is very easy to handle them. But this multifilament is been coated with a silicone to make it more smoother. And also this multifilament is very easy to slide into the tissue and easy to tie a knot. Next characteristic is a tensile strength. Tensile strength is nothing but the tension when you are expressing any force to break the thing apart. So when you are breaking the suture material, how much force you are applying, the required force to break them apart, that is nothing but tensile strength. So this tensile strength depends upon the constituent of suture material, which kind of material is used to make this suture. It depends upon them, and also it depends upon the wound and also its tension. So last characteristics is the absorbability. Absorbability is also one of the characteristics of a suture material. There are 2 types of absorbability in the suture material. One is absorbable, one is non-absorbable. Absorbable is used only in such wounds where it is deeper or where there is any kind of mucosal layer or where we cannot again open it to remove the suture. Whereas non-absorbable are used, these sutures are used only in the area, only in those wounds where we can remove it out very easily and it doesn't cause any harm. Next we will discuss the instrument that is required to do suturing. There are three important instruments that is required to do suturing. Those are first one needle holder, second one suture needle, third one are the suture material. So after this we will discuss the classification of suture materials. Classification is been divided into 4 different types. First one according to the source, second one according to the structure, third one according to the fate, fourth one according to the coating. According to the source, it is again divided into 2 types. One is natural, second one is synthetic. Natural are natural things used to make these suture materials. Synthetic are the artificial fibers that is used to make these suture materials. Second one according to the structure. As we have already discussed in the characteristics, the physical structures of the suture material, those are monofilament and multifilament. I'll repeat what is the meaning of mono and multi. Monofilament is one fiber or one filament used to make the suture material. Multifilament are the multi-fibers or multifilament brought together to make a single strand of a suture material. Next, according to the fate. According to the fate is nothing but it is about the development after suturing, what is the action of the suture inside the body. So according to the fate, there are 2 types again. One is absorbable, second one is non-absorbable. Absorbable sutures will be used in the deeper wounds or in the wounds which is occur to the inner organs or internal organs of our body. These absorbable sutures will be absorbed by the tissues in the bloodstream and will be excreted outside of the body. Non-absorbable sutures will be used in the superficial of our body parts such as skin or in your muscle layer. Last one is according to coating. According to coating, again there are 2 types. One is coated, another one is uncoated. Next we will discuss regarding how this suture material is being selected, which kind of wound, which kind of affected area or to repair which kind of tissue. Selection of suture material are always done by these 5 major points. First one is condition of the tissue or condition of the wound. Seeing the condition of the wound, how deep it is, how mild it is, how moderate it is, we are selecting the suture material. Second one, the tissue that should be repaired, whether it is internal tissues or superficial tissue or external tissues. So according to the tissues, we have to repair using some suture material. Third thing is the tensile strength. As I have already mentioned, tensile strength is a strength or the force expressed to make the material or make them separate or make them apart. So this tensile strength is very necessary to hold the tissue together. If the tensile strength is very weak of a suture material, then it cannot hold the wounds together or edges together and it won't heal properly. The wound will be always open and there is a chance of infection invading inside the wound. Fourth one, it is the knot holding characteristics. The knot, every single knot which we are tying after the suture is very important to hold together, because this knot, if it is not tied properly or because of the heaviness of the tissue or because of the smooth muscles of the tissues, this knot may loosen up and the wound again it may be open. The last component or last thing that should be taken care of is the reaction in the surrounding tissue. Whichever material we are using, those material are made up of some synthetic or some coating factors. So these coating factors or these synthetic factors may affect the tissue area or the cells or may have some reaction with the tissue. So you have to be careful when you are doing any suture. You have to see whether it is reacting to the tissue or any cells surrounding the wound. So there are different techniques that is used for suturing. So basically there are 5 different techniques in suturing method. First one is interrupted suturing, second one is continuous suturing, third one is mattress suturing, fourth one is figure 8 suturing, last one is subcuticular suturing. So we will discuss one by one. First one is interrupted suturing or interrupted sutures. Interrupted sutures are a type of suture or method of suturing in which we are interrupting however we want. We are not aligning the sutures in a proper measure. We are just interrupting it just to lock all the wound which is not regular. That means the wound edges will be not regular. In that condition, in that type of wound, we will use this interrupted suturing technique. Second one is continuous suture or continuous suturing. In this, again, it is divided into three different types. First one is simple continuous, second one is locking continuous, third one is continuous over and over suture. Simple continuous and locking continuous are very easy to do. Simple continuous, continuously without tying a knot, we will be suturing the wound. Locking continuous, we will be using knots to do the suture, or while we are suturing, we are tying a knot. But continuous over and over, it is a mixture of simple continuous and locking continuous. It will be a simple technique, or we are doing it continuously, but we will also lock the suture, or we will also tie the knot of the suture. Third one, mattress sutures or mattress suturing technique. In this, again, it is divided into two different types. One is horizontal mattress suture, second one is vertical mattress suture. Horizontal, it is horizontal way we have to, in a mattress form we have to suture the wound. Vertical in the sense, in a vertical direction from upside to down or from the down to up of the wound, we have to suture the wound. Next technique of suturing is figure 8 suture or figure 8 suturing. Here we are using the figure 8 type or a technique to suture the wound. In figure 8 we will suture the wound. This wound or this kind of wound will be present where there is any kind of extraction done. For example, your molar teeth extraction. At that time, there will be a deep hole also the area will be irregular. So, at this point of time, you will use figure 8 suturing method to close the wound. The last technique is subcuticular suture or subcuticular suturing. Here, it is done in the interdermal part of our skin, intradermal or intradermal part of our skin. So this subcutaneous layer of the skin, where if there is any wound present in that deep of the skin layer, then we will use this subcuticular suture techniques. Till now we discussed regarding the suture and its material. Now we also have to know why this suture and the knots which is used in this suture, how are they done, or what kind of knots are being done. There are different types of knots, there are different types of techniques to do these knots. So here surgical knots, they are known as surgical knots. These knots are divided into three different types. One is loop knots, one is knots, third one is ear knots. Loop knots is one of the component of a surgical knot which is composed when you tie a single thread or single suture to a wound. The loop will be contained of single knot. Second one, the knots. Knots are composed of many knots which is combined or which is brought together to throw a tight tensile strength in the suturing. Third one is a ears. Ears are the cut end of any suture. So there will be two ends of the suture material. So those two ends are known as the ears. Then we will discuss the types of knots. So there are three different types of knots. One is secure or square knots. Second one, the surgeon's knots. Third one, the granny's knots. It is very easy to understand. According to the name, the meaning of the knots are there. First one, it is secure or square knots. The knots tied in a square manner or in a secured manner is known as secure or square knots. Second one, the surgeon's knot. Here the surgeon uses his own technique to tie the knot to make it secure is known as surgeon's knot. So he will use one end, he will hold a one end and he will use the another end to tie the knot. So here the double end of the ears of the knots will be used to tie a knot. So that is why it is known as surgeon's knot. Third one, the granny's knot. So granny's knot is very easy to understand. As you have seen your granny making some stitching clothes or making some embroidery work, all those things. So this kind of works, they use this technique to tie a knot. So such kind of knots is also known as granny's knot. So sutures, after tying the suture, after tying the knots, there is also a method of removing the suture. So removal of suture is nothing but removal of the suture material that is already present in the wound area or in the past traumatic wound area. This removal of suture is not done in a normal way. It also has some principles, it also has some techniques. So removal of suture is based on how deep the wound was and how much duration it takes to heal. So according to that, we have to remove the suture from the body part. Suture material can cause irritation to the body tissue. That is why it results in the scarring of the body part. So here, for removal of suture, we have some certain days or certain period of time till when we can keep the suture on our body, and what is the right time to remove the suture from the body. Time duration taken for face and lips is from 3 to 5 days. Time taken for the wound to heal or to remove the suture in the part of neck or oral cavity is 6 to 8 days. Time taken when your wound is in the scalp is 7 to 10 days. Time taken for removal of suture in the area such as chest, abdomen, legs or upper extremity is from 10 to 14 days. So you have to manage this time. You have to keep your sutures clean using a normal saline, using some betadine, using some antiseptic solution which can also prevent from microbial invasion as well as growth in the wound area. So when you are keeping your wound clean, it may also help in wound healing as soon as possible. If this duration is prolonging or it is longing for more than 10 days or 14 days in this particular area or particular parts of your body, then you have to immediately consult a nearby physician or a doctor for any infection or any kind of abnormalities present in the wound or inside the wound. Lastly, we will discuss the complications that is occurred due to the sutures or suture material in the body. There are three mainly seen complications in the body parts. First complication is suture scars, second one is suture abscess, third one is dermoid cyst. Suture scars, you all know, as I told you, because of the suture material there may be a chance of irritation in the tissue of the nearby wound. So there is a result of scarring of the sutures. Second one, suture abscess. Suture abscess is nothing but pus collection in the suture area or a wound area. So when there is a time of healing, if the wound is opened again or if there is any loosening of the knots of the sutures, there may be invasion of the microorganism inside the suture or inside the wound, which may again develop into a pus formation. Third complication is the dermoid cyst. Dermoid cyst is nothing but it is a overgrowth or new growth of the tissue which is multiplied in various number of times apart from how much is required in that area. So sometimes what happens when there is new cell growth, there will be too much variations or too much mutations of the cell growth. In order it forms as a cyst. Cyst is nothing but it is a overgrowth of the cell. So this is about the suture material and removal of suture. So we discussed certain topics about definition, goals, methods and also types of suture materials and removal of sutures. If you have any doubts, please leave a comment down below. For getting more nursing related assistance or study materials, download Nursing Guru app from Google Play Store. Thank you. Bye.